Now, as I've said before, the body changes shape, or the spine changes shape to compensate for misalignments that you accumulate over time. And one of the things that happens is you lose the normal curvature of your spine, and your neck particularly. Your neck should have this is the front side, it should have a forward arc in the neck like this, and the mid-back should arc backwards, and the lower back should arc forwards. These are actually 60-degree arcs, the most strongest arc known in architecture. And when you lose that arc, you lose the strength of your body, or your balance, or your spine. It makes the muscles work harder, joints are under abnormal stress. And one of the main things that happen that really aggravates your nervous system, when you lose the arc of your neck, okay, the neck starts looking like this, like a straight neck, or actually reversed. It produces a traction on the spinal cord. Okay, in a good curve, like the wrinkles in my hand, the spinal cord is relaxed, like the wrinkles in my hand. But when the curve is lost, it bends the spinal cord back, and it produces a tautness, a stretching effect, like a rubber band. If you stretch a rubber band, does it get thicker or does it get thinner? It gets thinner, doesn't it? So a good curve in the neck not only produces a stronger, more balanced, more flexible spine and more relaxed muscles, it relaxes the spinal cord, which is extremely important for basically brain to body connection. We want less tension on the spinal cord. Okay, so what are one of the things that we do to help the spine have a good curve in the neck? Is not only the advanced biostructural correction, the type of chiropractic care I do to align the spine, but we also do a procedure called body weighting, or posture weights. Now, what these are, it is a counterbalance basically to your postural imbalances. So a lot of times with our lovely assistant here, Rachel, see, when she's standing here, the center of her head is right here, and the center of her shoulder is right here. Those 2 points, and the hips too, all these points should be in a straight line. So you can actually look at your spouse or your friends and determine if your body is out of balance. This point here should be in line with the center of the shoulder and the hip and the ankle. All those should be a straight line. A lot of times the hips shift forwards and the head shifts forwards to try to counterbalance. So what do we do to counterbalance that? We use posture weights. We're actually going to put a head weight on her that the body will actually say to itself, well, I don't want to fall forwards, I want to center that weight back up. And so what will happen is the head will traction back to center this extra weight up, and it's going to activate a lot of systems I'll tell you about in just a second. Let me just show you how that works. So now, Rachel, you know how this works. Go ahead, and there's a couple pounds in here. Let's put that on like a hat. And just like that, okay? And this is what's happening here. This extra weight here, the body's going to have its own balancing system to rebalance that, center that body weight back up. And we also put a little strap around that produces a fulcrum that the weight can work off of. And her head, her natural self is trying to rebalance that. So what's happening with the posture weights is all the little intricate muscles in her neck, her mid-back, her lower back, all the way down to her feet, the brain is perceiving this different weight, and it's activating all those little muscles. Okay, so those are strengthening. The next thing is it's re-educating the neurology throughout the spine. Thank you. Okay, we're in the middle of video.
I'm the photo
Cut.
bomb.
Photo bomb. Okay. Thank you so much. Okay. Redo. Okay. So now, what is happening with the posture weights? The body is assessing this need to rebalance itself throughout the musculature in the neck, mid-back, lower back, the hamstrings, and even down to the feet. So the whole body is rebalancing itself and strengthening these little muscles, even the big muscles. The next thing it's doing is re-educating the neurology, actually in the cerebellum, the follicular nodular lobe that is creating input into the postural muscles up along the spine. So it's re-educating the cerebellum, the part of the brain that controls body balance and center of gravity. So this is extremely important. So what we're going to do, we're going to have Rachel wear these, and she's going to stand on a vibrating platform that we'll show you in a moment that super stimulates all the joints and all the nerves and all the muscles of the body, and it really speeds the process along. So whole body vibration is what we'll use when you're using the head weights. It only takes about 10 minutes, really quick, really easy, feels kind of neat, and helps strengthen that body. Now what we're going to do when a patient comes in with this is we're going to actually determine what weight works best for them by doing a little x-ray. So we'll take an x-ray with the head weights on and see what that neck curve is doing. And let me show you a few of those x-rays right now. Thank you. Okay.